So bariatrics is basically the treatment of obesity. The surgery can be considered weight loss surgery, but really I think it's more of a metabolic surgery with side effect of weight loss. The key thing about surgery is that it is the only known treatment that is sustainable. Lifestyle modifications, I think, are important and they go with surgery, but by itself you only see 5% of total body weight loss with modifications, where there is a perception that this is cosmetic, but really it is not. I mentioned before, obesity is a progressive disease. And so it takes sometimes a while for someone to maybe experience something that comes from their obesity. With obesity, if someone has it early in their lives, such as in their teens, below the age of 10, they may need joint replacements prior to the age of turning 18. If we utilize an intervention earlier, it actually prevents them from having those other end organ problems or cardiovascular events or strokes that is worsened by an untreated disease. It should never actually be thought as a last-ditch effort. And so I think that's actually why it feels like there's some sort of severity to it. So in general, with like any sort of complex disease, let's say that someone gets cancer at the age of a childhood, surgery is not a last-ditch effort because it's the same disease, no matter what age someone has it. Each person has their own story. What I love the most is that they will tell me, if they're able to participate in certain activities they never thought they could, or they were able to accomplish something that their weight no longer is a problem. So I think it's a different way to look at obesity. So it's no longer cosmetic. It's no longer one treatment should fit it. It should be looked at as a multimodal lifestyle change on top of a tool, that's the surgery itself, as well as potential other medical options that we have, which are growing, such as medications and other things that support a person, because obesity does affect more than just what the surgery will address.